Steve Cashel, Dr. Brian Cole, back on Sports Medicine Weekly here on Web Talk Radio, and always a hot topic, Dr. Cole, concussions, right? I mean, whether it's almost any sport now, but you think about it with the Blackhawks' recent run there in the Stanley Cup Finals, concussions always are. They're talking about upper body injuries, and rumors abound. Are there concussions? But we're going to get into the football season here coming up again. Training camp for the NFL not far away, and then obviously concussions. As hot a topic as ever, isn't it?
It is, and it's the oversight has increased exponentially. I mean, it's interesting. In the NBA, for example, there's someone watching every game. And virtually every event that looks like a concussion, there'll be some follow-up the next day via email and phone calls, what was done, what was assessed, and so forth. And in many sports, there's actually an independent individual who helps to deal with return-to-play issues just because of the potential conflicts of interest and so forth. So we become very sensitized to the risks of putting someone out there when they're in that post-concussive phase, which can cause a recurrent phenomenon that could be even worse, and post-concussive syndrome, which we'll talk about a bit. But the point is we have to be so careful about determining when it's actually safe to get someone back. And there's all those potential conflicts and pressures that can happen, as you can imagine. And it's added a lot of objectivity to actually have an outside individual who is an expert help determine when it's safe to return to play and sort of watch over it. Even though we all know what the right thing to do is, it's still a series of checks and balances that keeps all the incentives in the right place.
As a team physician for the Bulls and White Sox, you don't see as many, or more than you think?
We've had a couple. We've had a couple trips to the emergency room with CT scans and things like that of the head.
Hit by pitch, or being hit by a ball?
It's either hit by a ball, or in basketball, it's going to the floor and just slamming the back of your head to the floor, or getting elbowed really hard in the head. We've had a couple that way. Fortunately, they've been minor, but it's it's like the sixth vital sign, I mean, it's just every day we're talking about concussion. I'm an orthopedic surgeon, for goodness sakes, and we talk about it every single day I'll be in clinic, and it comes up on a regular basis. And I meet these kids who are 12 years old who have been missing seasons because of serial concussions. I mean, it's crazy.
Wow. Well, our next guest is Tim Rylander from Accelerated Rehab. They do a wonderful job. Tim, located in Western Springs. That location, Accelerated Rehab Centers, locations in Illinois, Iowa, Indiana, Michigan, Wisconsin, Missouri, Ohio, and Arizona. And Tim specializes in identification and treatment of concussions, a physical therapist, as I said. And you want to talk a little bit, Tim, so we welcome you into our studio here at ESPN Radio and Web Talk Radio for hockey and football. And it's becoming almost an epidemic, isn't it?
That's right, Steve. Thanks for this opportunity. And the thing about it is, while the high list of high-incidence concussion sports continue to be football, hockey, and really any kind of impact activity, really any team sport, you're at risk. The idea is to be aware of your own risk and to be aware of the signs and symptoms of a concussion.
Well, let's talk first about hockey. Okay, the hot topic, obviously, with the Blackhawks run at the Stanley Cup, and so exciting to see that. And are hockey players, let me ask you, Tim, at a higher risk for concussions than any other athletes?
Well, really, any athlete who participates in a contact sport is going to be at a higher risk of concussion due to the high velocity of these athletes, and athletes basically getting bigger, stronger, and faster year by year. It's important, once again, to understand that beyond the sports arena, I mean, you're susceptible to concussion whether you slip and fall or even, on a trampoline.
Okay. Something that jumps out at me, helmets. I'm thinking about, can they ever make a helmet? And in football, it's a little dangerous. You don't want to make the helmet too, what am I thinking?
Protective.
Too protective, right? What kind of material are you using?
I think it's almost hard to make something too protective, I would imagine, at this juncture.
It's almost hard to make something too protective.
But don't you think about a material that might be, if it's too protective, it would hurt the head then?
No, because it's an area of the helmet rarely ever breaks down or cracks. Right. And it's one of those things that, so in the event, so it doesn't fail at the baseline. So I would say it's and plus the way they hit now and the way they're instructed to hit in terms of head position, neck, body position, I would say it's rarely an issue. I mean, it's really just an issue of a suspension system and how it absorbs energy. I mean, even the level that, we've looked at it, and there's concerns in baseball now for protective headgear and so forth that could potentially.
They did make a better helmet, didn't they? It's a little bigger, I heard. It's
baseball,
you mean
the hat? You're talking about
the baseball helmets?
Baseball helmet? Yeah,
Yeah.
that's correct. And actually building in the hats they're looking at.
Is that right?
But anyway, so let's. I'm just curious. So your program, and I understand you're the director of the entire initiative. Is that correct?
Correct.
Give me sort of the prongs of what you guys are putting on the table for individuals, and this is really important for our youth who often the families don't really understand where to go when a concussion happens. So let's say you've got a kid on a Friday night who presumably has a concussion. There's an athletic trainer that told the parents this, and they are going home and they're doing the questioning, well, do I got to wake them up every hour, and what do I look for, nausea and all that stuff, and they make it to the next morning and we're pretty confident this kid's had a concussion. What are the steps they can go through, and what are the things that you can provide to get them back to play?
Well, our program actually has multiple facets. One facet of it actually begins before that date of injury, and that's extensive community, parent, and coaching education. So once again, it's important to stress that these athletes need to be honest with their symptoms, and there needs to be a general overall awareness of what's going on with these individuals. Once moment of injury possibly does occur, typically what's conducted is follow-up with the team physician or the sports medicine team, and a neurocognitive test is conducted later on compared to baseline levels.
So are you guys offering the baseline testing?
We are offering baseline impact testing, which is a neurocognitive test most widely used in the concussion arena for athletes of our sports medicine program. And then then following injury, we conduct.
Are you going out to the schools and saying we'll test a whole team?
We'll test a whole team. Whether it be club, high school,
and
high.
you guys will house the data yourselves.
Well, the data itself is housed by Impact, which is the testing affiliate.
It's in Pittsburgh.
Mm-hmm. Yeah. It was originally designed through associates of the University of Pittsburgh.
Right.
It's been well validated from ages 11 on up. Interestingly enough data has been collected on Impact where nowadays, even if you don't have a baseline test, a post-injury test is still very useful
because you can use normative data.
You can start to compare to normative data.
Yeah.
Now, it's not as spot on as a baseline test, but it really gives you a good step in the right direction.
How pervasive is the pre-injury testing now amongst the youth? Do you know if you look at
it's really gaining steam.
Okay, so if you went to the high schools and the suburban high schools in Chicago of Chicago, the suburbs of Chicago, do you know if they're doing it now regularly?
Oh yeah, definitely.
Okay, and across all sports?
It goes school district by school district specific, just because of logistics involved. And in some of the school districts where not all sports are conducted, the quote unquote high risk sports are conducted. So your impact sports and your sanctioned team.
And the public schools, do you know if they're doing it?
Yes,
because I know some of the private schools. I've talked to them, and they're not doing it routinely.
Yeah, actually, in my experience, it seems to be that it's actually more widely prevalent in the public schools as opposed to the private schools.
That's interesting.
Now, why would that be?
It could be anything from risk aversion to,
Yeah, and just general logistics and the sheer number of athletes in a smaller private school versus...
the private school, you're talking about small teams, small squads. Many of them don't have football, which is still one of your highest risk sports. There's probably fewer risk, and I think my guess is it'll happen, and probably within the next year.
I wonder if it's ever going to be mandated by the IHSA.
It'll be interesting. I don't know where they currently are in that regard. Do you have any idea?
No, I mean, Illinois is considered does have a concussion law on the books, which generally has multiple aspects to it, including enhanced coaching education, enhanced athlete education, and the rule that if an athlete does sustain a head injury on the field of play, they have to be removed from that field of play, and they cannot return until they're medically cleared.
Our guest is Tim Rylander from Accelerated Rehab, a physical therapist specializing in identifying and treatment of concussions. Tim's located in Western Springs, that location.
All right, so Tim, so let's continue to walk through this, because I think that's, to me, is most helpful. And if I had a kid and I need to get through this, all I really have access to are the physicians who they don't test them, but they can give them some management tools in terms, like Jeff Mianis has been running a concussion program at Midwest Orthopedics. And he'll give them the tools as far as how to get back to sport, what to look for, some of the testing and so forth. But from your angle, you can do the pre-injury testing, you can do post-injury testing, right? Mm-hmm. Are you doing some of the rehabilitative aspects?
Yes. Our rehabilitation aspect kind of has two main tracks. Now, it's important to recognize, as much as I stress time and time again whenever I talk to people that concussions are a very serious injury and need to be taken seriously, it's also important to recognize that statistically speaking, 80% of individuals are going to be asymptomatic within 3 weeks. So while it's a very serious injury, it's also a very recoverable injury. And that's very important to recognize. So for those individuals who are asymptomatic, let's say a couple days or a week or two after injury, we take individuals through a 5-day validated return to play protocol. So what that is
it monitored or by anyone, or
it's monitored by either a licensed athletic trainer or a physical therapist.
So they're coming to a place to do it?
If the athletic trainer is conducting it, it's typically done in a school setting.
Okay.
Through that school sports medicine team.
Okay.
Or they come into the clinic or seen on field by a licensed physical therapist. We take them through a 5-day protocol of progressive cognitive and physical exertion.
And some of the current literature has really focused on balance, right? Am I right about that?
Yeah.
Like we were doing a lot of these assessments, but it seems like balance is becoming one of those independent findings that is very sensitive to a post-concussion syndrome. Is that fair to say?
Yes, it's fair to say. I mean, it's an easy answer to give, but a very hard pill to swallow. I mean, truly, no two concussions are alike. So there's a couple kind of hints you can look at prior to injury or right after injury to really determine if you're going to have hopefully an easier road to recovery or a longer road to recovery. Acutely, we tend to see a lot of balance dysfunction or kind of vertigo type symptoms or dizziness.
Right.
Okay. Interestingly enough, loss of consciousness doesn't necessarily wane towards a more severe or a less severe concussion.
Right. How does a parent know their kid has a concussion?
Well, typically, if they're evaluated and triaged at the sideline, either the team physician or the athletic trainer will personally contact the parents. Through accelerated rehabilitation, we have a policy of handing out, disseminating written information to the parents, as well as making personal contact with the parent, give them information as far as signs and symptoms to be aware of for significant kind of sinister pathology or just general treatment protocol. Commonly, immediately after injury, what we suggest is both physical and cognitive rest. So kind of just shutting them down, give them a little break, let them sleep, let them rest, try to limit, cell phone use, computer use, and so on and so forth. And then follow up usually 24 to 48 hours afterwards with the sports medicine team to kind of see where you are at that point. If they're feeling better, we institute a post-injury neurocognitive test. And then once they're asymptomatic, we take them through return to play protocol.
Does the impact test have to be corrected before you'll drive them through that protocol? In other words, they have to be back to where they were?
Yeah, we want them to be, before we enter them into the return to play protocol, we want them to be asymptomatic first off. So no hint of a headache, no dizziness, nothing like that whatsoever. And their impact test has to be back to baseline.
Got it.
So if individuals continue to have symptoms weeks down the road or 2 to 3 weeks down the road, then we implement utilization of our physical therapy staff to institute vestibular rehabilitation, manual therapy techniques, and neuromuscular reeducation techniques to help with any kind of orthopedic or musculoskeletal issues that may occur, such as in the neck with headaches or so on and so forth. Ocular motor issues are kind of working with visual disturbance or concentration issues, as well as, like you mentioned, balance dysfunction or dizziness symptoms.
Tim Rylander, our guest, Accelerated Rehab, a physical therapist specializing in identifying and treatment of concussions. Finally, Tim, how can people get a hold of you at Accelerated?
You can get a hold of me via email, Rylander, TRYLANDER, at acceleratedrehab.com. Or I can be reached at 1-708-783-1044. And once again, thank you guys very much. Education and awareness is really huge for concussion. I think it's a vital aspect, and opportunities like this are really valuable for me. So thanks again.
Valuable to the parents out there and the kids as well. Thanks so much. Tim Rylander from Accelerated Rehab. Back with more of our program after this.